Good afternoon. I have that feeling that after a long day, everybody said everything I was planning to say, but said it better. So I'll keep my remarks short. My name is Chesley Richards. I'm the Deputy Director at CDC for Science and Surveillance. And in that role, I supervise the Center for Surveillance, Epidemiology, and Lab Support, which includes the National Syndromic Surveillance Program, Notifiable Diseases, and MMWR. I also supervise the National Center for Health Statistics, the Office of Science, which has most of our data policies and scientific IRB issues, and the Laboratory Safety and Science Office, which deals with laboratory issues. So it's a broad mission that I have, and I report directly to Dr. Redfield, our CDC director. And when he and I first talked, when he came, he said, "You know, Chesley, I didn't come to CDC to become a medical historian. I'm surprised at how many historical analysis we do around here, and I want to take the agency to a place where we're doing real-time work and predictive analyses." And so he's given us a charge to really change the way CDC is dealing with data and the way we deal with our state and local partners who are so critical in obtaining that data. I want to summarize my observations through the day in 4 comments. The first thing is that for disaster-related surveillance, I think everyday systems are key. Everyday systems need to be robust, but they also need to be able to adapt and flex in the disaster. Second, resiliency in data systems can be advanced with electronic systems and digital data. I'm fully convinced of that, and we've heard some examples of that. But we have to build that resiliency in as we build those systems. The third thing I would like to say is that at a federal level, I feel like, and this is part of the charge from Dr. Redfield, we really have to do better aligning our resources, our requirements, and our technical support so they really help people on the ground during the disaster. Now, to do that, there are certain things that we need to standardize even at a national level. And we need to be serious about that standardization, and that's hard work, and not everybody's going to agree with it. But we only need to standardize that's critical to be standardized at that level. We need to maintain flexibility at a local level for local responders. And then finally, I'm fully convinced the technology exists to solve most of the problems we've talked about today. The problems are not the technology. The problems are the resources, both financial and workforce, the requirements in terms of what types of data we require, whether CDC is requiring locals to provide or what local state governments are providing locals to provide, and how we enforce those requirements, and the policies around those data, and the way we share data. And then finally, the relationships. And most of the relationship issues I've heard today are around trust. And trust needs to be built outside the disaster. It needs to already be there when we come into the disaster if we're going to really be able to share and use data in the way that I think we can for the future. I'm very humbled to be here and thankful to be here and look forward to the discussion. Thank you.